So the key message within the Prudent Healthcare chapter on workforce is that in the future, the workforce will fundamentally look very much similar to what it is at the present time. We will continue to have a wide range of therapists, doctors, nurses, pharmacists, and so on. We will have all those professional staff groups. The key issue that will change is the area where they practice. So we'll see much more care delivered in primary care and community settings, and we will also see those practitioners undertaking different elements of care. So the way that they work together as integrated teams, what they do, the roles and responsibilities of each different staff group, that will be the fundamental shift and change in regards to how the workforce will be different in the future. There's 5 key issues which we've got in the chapter which really underpin this. Firstly, that we need to recognise the contribution that individuals and staff groups can make. And we need to provide the freedom within the NHS for those individuals to practice and to undertake those, deliver those services within the governance frameworks which are already in existence across the NHS. Secondly, good management will address many of the issues that are many of the principles which are evident within the Prudent Healthcare agenda. So good management of the NHS workforce will go a long way. Thirdly, we need to look at integrated planning across the service, the workforce and financial planning systems. And we need to recognise that from a workforce point of view, integrated planning has a longer term time frame than what we see from many other arenas. The workforce agenda means that we need to think of the workforce in planning terms of 10, 15, 20 years time. So we need to really seriously look at the integrated planning agenda in the long term. Many of the tools and resources that we require for workforce development, workforce redesign are currently available. There's been a lot of work undertaken within NHS Wales to develop those tools, and they are there and they need to be utilised systematically across the whole system. And finally, we need to support innovation and change. We often get a bit scared or nervous about introducing some innovation and introducing change, and we need to embrace that and actually see those things taken across the whole of NHS Wales in a systematic way. The workforce is central to the delivery of healthcare. Healthcare is delivered by the workforce. It's not delivered by buildings, it's not delivered by systems or processes, it's delivered by people. So the workforce is critical to the Prudent Healthcare agenda.